Hi everyone, my name is Alexis Clouser and I am an MPH student in the Health Policy and Management track. I am pursuing my master's degree in public health as well as working full-time at Arkansas Blue Cross and Blue Shield. I'm a data analyst there. I look at data for our large groups, and this is I just finished my first full year in the program, hoping to be done in 2 to 2.5 years, and then potentially pursue a PhD at some point. We'll see what happens there. So I think the similarities between this plague pandemic, the bubonic plague, and COVID, I noticed some similarities while I was watching the video. One of the similarities I think that stood out to me the most was the latency period, or like the period where the infected people were asymptomatic. And the video was talking about how with the plague, people would be carrying around the plague and they wouldn't know it, and they would infect other people while they weren't sick themselves. And this reminded me a lot of COVID, because there were lots of people who were asymptomatic and were unaware of the fact that they were actually carrying the COVID virus, and they would infect other people during this period of being asymptomatic. And then sometimes they wouldn't be symptomatic during any point while they had COVID. So that reminded me of a similarity. And then really I noticed similarities in just like a lack of protocol, or people not knowing what to do, or not knowing what caused the virus, how it was spread. We do know more now with modern medicine than they did back then. But when COVID first started coming to the United States, not many people knew what it was, how deadly it actually was, and how to handle it. So it seems like there were some similarities there as well, with like the level of familiarity that people had with the disease, and how much havoc it could actually wreak on the population. And then based on my reading, I think epidemiology could have been used to contain the pandemic if they would have enacted an automatic quarantine on the people in Europe. Like as soon as the plague broke out for the first time, if they would have had everyone quarantine in their homes. I think that sanitation of the streets, obviously the rats, and ticks were a huge carrier, and the fleas on the rats. So I think proper sanitation and disposal of said rats, if possible, would definitely have played a role in helping to contain the pandemic. And then I think just learning, now this is more like after the fact, but using epidemiology to study this pandemic has likely helped to equip us with better ways to combat this. Well, I say that obviously the COVID pandemic, there were lots of areas that could be improved upon there as well. But I do think the Black Plague serves as a very good example of how not to handle a pandemic. And I think the epidemiologists definitely can study that and use these things that we talked about to look at like the host environment interaction, and then just preventative measures for plagues going forward.